Welcome back. So there will be a lot of expectations concerning what happens today. How do we integrate ourselves into, this next phase, whatever the phase is or whatever the phase will be. Well, to give us some perspective on what has happened previously, an idea of where we are, and perhaps what we should look forward to, we've got Professor Innocent Uja joining us from Abuja. Well, good morning, sir. I remember the last time you were here as the DG of NIMR, but now you are the president of the NMA. Congratulations on your election, on your victory.
Thank you very much, Chamberlain. Happy New Month.
Well, it's going to be a very interesting one for you, the NMA. And what a time to be the president of NMA. What do you plan, how do you plan to approach your leadership? Because, the country will be looking to see there are several things playing out in different states of which you need to coordinate, even at the center as well. So what should we expect from your tenure as the president of NMA?
Well, thank you very much, Chamberlain. Like I said, Happy New Month. Before I start, I want to thank my colleagues for giving me the victory, for voting for me, for having confidence in me, and I also dedicate my victory to my family, my wife and my children, and my very good friend, Dr. Dennis Ifene of the blessed memory, with whom we have come all this way. The question you asked is very relevant. There's no doubt that there are very many challenges, in the health system in Nigeria and the welfare of Nigerian doctors. The challenges are enormous, but we are prepared to hit the ground running. One, the issue of the COVID pandemic and the response. And as it affects my members and other health workers, and in fact the Nigerian community and the socio-economic circumstances of the time. The second is the issue of the welfare of Nigerian doctors. The third is working with partnership with government and other agencies to improve the health care of Nigerians. There's no doubt that the COVID pandemic, the global health emergency caused by COVID-19 has exposed how weak the health system of Nigeria is. It's very clear that there are lots of gaps, and that has made it really, really difficult to respond appropriately. People are doing their best, but there's a lot of work to do. We work with other agencies. We will improve on our capacity development because doctors must continually be trained, and we'll enhance that. We'll bring to bear, what we call a public lecture, annual public lecture for Nigerians on contemporary issues, because we cannot stay in a Nigerian community and not respond appropriately to the happenings in Nigeria. So this is a summary of what we'll be doing, but by and large, the greatest challenge now is how effective and how appropriate we will respond to the COVID pandemic. It's a global health emergency, not just health, but social and economic. You can see that we've been locked down for about 6 weeks, and a lot of things are happening. So we will need to interface with government and support and contribute to the containment of the COVID-19 pandemic, because Nigerians are suffering.
Now, if I could just bring in this, you have highlighted some of the challenges that the health sector is facing, as many other people, even those in government, have also pointed out. Have you heard anything that gladdens your heart about what the country ought to do next, or what they're planning to do next, having seen the gaps that the health sector is facing?
Well, the issue is that they are doing their best. The government is doing its best. The health workers are doing their best. And the partners are doing their best, but you can see that we need to review. We need to review what we are doing. Is it appropriate? Is it correct? And this comes through what? Evaluation of our activities. As a researcher, I think that we should have a very strong research team that will evaluate our activities, because it's not enough. You know, if we are doing this, if it's working well, how will it work better? If it's not working well, how will it do it? What would we do? And research findings is not, anything that is very fantastic. It's just data assessment and evaluation. And I'm not very sure, and I cannot say because I do not know, that the PTF has a research team to evaluate their activities, because we must evaluate, we must monitor what we do, so that we can then reorganize ourselves to see how we can appropriately respond to the pandemic, which is actually causing a lot of problem, not just to Nigeria, but to the world. But we need to do our own bit. We then necessarily need a research team. I understand that there is an advisory team headed by a great virologist, Professor Tumori. I don't know their terms of reference, but the reality is that we need to have a research team that will monitor regularly and evaluate what we are doing, because otherwise we'll just be groping in the dark.
Are you saying by that, just one moment, Professor, you've just talked about the need for research. Now, quick follow-up on that before my question. Are you saying that the research apparatus that we have in Nigeria are not enough? Of course, you have been DG of a medical research institute in Nigeria, and that, of course, you are not unaware of NIPRID and a few other agencies of government that have been involved in research and which have, produced one thing or the other. Are you saying those research facilities are not enough, or what exactly are you talking about?
No. What I'm saying is that the response must be evaluated, and you don't need to have a NIPRID or NIMA, even though they should contribute. But there must be a research team of the PTF that will evaluate the activities regularly. If you say we should wear face mask, what's the percentage of Nigerians that are wearing face mask in Abuja? You say social distancing, that is completely out. There's nothing like that social distancing, in my own observation. I've gone through to places like Nyanya, Mararaba, and it is just business as usual. Go to the market. There's nothing like social distancing, and we need to know why it is so. We talked about self-isolation, and I think that is one area that we probably didn't get it right. The self-isolation, how can a family of 10 in Face Me and Face You house have self-isolation? Self-isolation if it comes back. Our culture and tradition must be evaluated to see how we can appropriately respond. For instance, if not because of the lockdown, I return from, say, United Kingdom, and then you say I should just go and stay in one room. Is it culturally acceptable? Now, my people will welcome me. My daughter or my son will come and hug me. And before you know, if I was carrying the virus, I would have transmitted the virus, to the family. And then, of course, many Nigerians live in rooms, Face Me and Face You room. And with 10, 11 children, on what ground can they self-isolate? On what ground can they have social distancing or physical distancing? It's practically impossible, and we must not deceive ourselves. What we need to do is to respond appropriately using our culture and custom and see what we can do to help us. When Ebola we had Ebola, the issue of social distance did not come. We know that the mechanism of transmission is different. But people were working, but the health, the Nigerians, we were practicing hand washing, we were using hand sanitizers, we were using thermometer to measure ourselves, and it worked. It appeared to work, and I thought it worked. Now, I believe that we should intensify that. Apart from that, the National Orientation Agency should do its work. Because this thing came and it was thought that it is going to go away by prayers and by wish.
Well, Professor Oja, if I could just jump in and ask you, should we expect from the NMA, for instance, having seen how all of this has played out and the challenges that we face, should we expect NMA to itemize some of these things? I mean, in case the government or someone somewhere may lose track of these things and turn to some other things that, how one thing can happen and it turns the attention of the entire country to that matter, and we then forget that we still have a huge challenge with the health sector. For instance, many Nigerians, once you get to the hospitals, the first thing is, look, if you don't deposit a certain amount of money, it doesn't matter the condition of whoever you brought or yourself, you won't be attended to. Health insurance is a challenge in this country. So are you going to itemize some of these things such that everyone, or you can forward them to government eventually, saying, look, these are the areas, perhaps low-hanging fruit of what they need to address immediately, to give us at least a semblance of what people can then say, well, at least we have a health sector that's responsive.
Well, thank you very much, Chamberlain. Policies are not a problem in Nigeria. I was in the National Institute for Policy and Strategic Studies. And if you go there, you see the deposit of research work that was done. You can write, but you cannot force government to decide to implement. The truth of the matter is that my administration will work very closely with government. And I believe that they will listen to us. They should listen to us because this is our domain. We have strategic advantage over other practitioners. And they should be able to listen to us. We have made our inputs and will continue to make our inputs to the policies of government. But it is love for them to implement. If they refuse to implement, we don't have that powers to compel them to implement. But we believe that working with government and clear understanding, collaboration, advocacy, and consultation, I believe that government will take the NMA more seriously than before. Because, for instance, the PTF has no NMA representative. I mean, we cannot be shaving our hair. They cannot be shaving our hair in our absence. The truth of the matter is that health is a custodian of medical doctors. We are the leaders of the team. And we should at least be part of the process. We should not be waiting and then be asked. We should be able to let them know at the right time that this is what we should do and how we should do them. It doesn't mean that we have monopoly of knowledge. We consult with others, with other members of the health team, and work as a team to bring out the best in the national response to the pandemic, as it were. And the issue of the hospital, like we said, if there are emergencies, no emergency will be turned out. Every emergency must be treated, and that allows for the first 24 hours after the emergency. And if the doctor evaluates and finds that the emergency is not over, we're obligated to continue to treat without asking for money. And I believe my colleagues in the teaching and the specialist hospitals do understand this. But we don't have control over this.
Dr. Oja, Prof, when you say these things, it's different in terms of what's practicable out there. Because if you say the first, 24 hours, they should treat with these things don't happen in the hospitals.
That's what I'm saying. And it should be implemented, it should be evaluated. If it's not happening, why is it not happening? The government has policy. The government should monitor its policy. We have, in a federal establishment, we have a Department of Hospital Services. Its responsibility is to oversee the teaching and specialist hospitals of federal government. The state governments have their own. What we need to do is to monitor. It's not enough to say 24 hours, you should after 24 hours, or you should not pay anything for the first 24 hours. If that is the policy, why is it not working? That's the evaluation I talk about. And that is a basic research that should be done. It's normal, just data collection and analysis, and then bring out facts. Because we must talk with evidence. The time of speculation is over.
Collaboration. Right. In terms of collaboration, I mean, with the PTF at the federal level, and of course, maybe the EOCs at the state levels, I'd like to know what specific terms you're talking about. Because if you say the NMA is not represented, for example, you talk about shaving your head in your absence. But I look at the PTF, for example, and I can count at least 4 medical doctors. You have the coordinator of the PTF, Dr. Aliyu, you have the Minister of Health, the Minister of State for Health, you have the DG of the NCDC, all of them medical doctors, and I want to believe members of the NMA. So in what specific ways are you looking to collaborate with the PTF?
Apart from NCDC are politicians. They
Get that, sorry.
They are politicians. And,
Okay.
and I just want to let you know, yes, they have their knowledge, but they are not practicing. They are administrators. They are administrators. We are looking at people who have evidence from the practice. The national coordinator, yes, is a medical doctor, but he could not do it alone. I'm saying that we need to be involved. We should not be at the sideline. We need to be involved. And it is not, we are saying not, it is not out of arrogance or it is because we are the custodians. And that's what I mean. We should be involved, closely involved. It is not about saying that we have a minister of state. They are all doctors, that is true, but they are administrators.
But in what specific, I understand.
Those that are in the field, the enemy is in the field.
So in what specific ways? Because, I mean, I'm glad you're bringing these ideas. So in what specific ways do you want to be involved?
The PTF has terms of reference. We want to be involved in every aspect of the terms of reference, apart from money. We are not dealing with money. We are not finance officers. But the reality is that I have mentioned, I'm not sure whether the PTF has a research team. Now, if you involve an NMA, NMA knows every of his members and the capacity of his members and bring them together within a short time, do this and want results in the next 48 hours. And they will do it. But
perhaps
look at and say, Uja is handsome or is this, I'll bring him. What is the impact? I mean, look at it. We have epidemiologists, we have infectious disease specialists. Where are they? Where are they? That is what I am asking.
Professor, perhaps another way to look at this would be to even, well, there was something you mentioned earlier about collaboration with various agencies and all of that, and that's a given. But perhaps, you may also reference the fact that this pandemic has, revealed certain serious fault lines in the healthcare delivery sector in Nigeria, the entire gamut. For instance, while the NMA is making agitations, Association of Nurses and Midwives want recognition, lab scientists want recognition, biologists want, different segments of the healthcare value chain are looking for recognition one way or another. So if there is going to be a collaboration, don't you think that's where the whole thing should start from, where every agency, every association, every segment of the healthcare value chain is represented under one umbrella? And if you say the NMA is the lead body in all of these, is this fact accepted by all in the healthcare value chain?
Let me just say that we are not in a beauty contest field. It's not about the doctor or nurses or pharmacists or no, to be recognized. We are not looking for recognition because we already have recognition. What we want to do is to work. And if you say we agree that we should all work together, but who was the coordinating body? The coordinating body is the Federal Ministry of Health. They should put us together and let's work. We want to work. We are not interested in recognition. The doctor is not being recognized. The doctor is already recognized.
One moment, profs. One moment. Would you be happy, would you be willing to make any moves to bring together all the practitioners in the healthcare value chain, the NMA, the nurses and midwives, biologists, lab scientists, and all? Is this something is it an opinion that you think, you might want to experiment?
Well, why not? Why not? Is there any reason for not coming together? We're all health workers. We come together. In fact, my predecessor did a lot to improve the harmony, interprofessional harmony among the healthcare professionals. We should work together. We have a common objective. common objective is to see how patients are properly treated and discharged, with minimal complications that may arise. There's nothing wrong with that. We could do that, and I can assure you that when I emerged as president of NMA, the other professional bodies sent messages of congratulations, and that is what we want in Nigeria. It's not a beauty contest. The doctor is clearly the leader of the health team, but we must work with others, even with the messengers in the hospital, because the messenger is also important. The security people are important. Anybody working in a system is important, but there must be a leader, and that's what the doctor is. It's just like, we entering the plane, and we have the pilot, and the pilot is the commander. There's no two way about that. But there are all other cabin staff that are working. So it's not an issue of the doctor says we're not the only one. Even in all systems, even in accounting, you have the accountant. In the armed forces, you have the army chief, and you have all the others working. Do you know that in the armed forces, a doctor is a support staff? As great as a doctor is, because a doctor can never be an army chief. That is the truth. Just the same like the Air Force and the Navy. So we must know our operational capacities, our callings, and there shouldn't be any problem with this. I think probably some outsiders causing some misunderstanding among the healthcare professionals. Otherwise, there shouldn't be any problem as to who is what. And I can clearly tell you that we work together. I am very, very interested in working. We are our colleagues, and we know we have defined roles and responsibilities, and that should be clearly known to all of us. And I don't see any problem with that. So, in the final statement on this is that we can work together and work for the health of Nigerians, because Nigeria, and like I said, this pandemic has exposed the weak health system in Nigeria. It is thoroughly, thoroughly obvious. And perhaps this is time to talk about the Chief Medical Officer of Health, also Surgeon General, that we have been advocating for years. You could see that coordination in the pandemic here is not as effective as it should have been. We know that there should be unity of command, and the president is doing his best. But how can a state go against the directive of the president in a national emergency? The state says they don't have COVID, nobody should come and do their test, and that nobody, if you come, you'll be quarantined. There must be unity of command.
Okay, Prof.
Coordination.
What we'll do is we'll talk about that a little more when we return in a moment. Stay with us. All right, welcome back. Well, Professor Anthony Innocent Uja did talk about the developments in Kogi. But, Prof, what do you expect to happen at this point in time? Because the NCDC did say, look, these are facts as they were. And then if Kogi is saying, look, they don't accept those kind of results. In fact, there was even a protest in Kogi against the cases that have been declared by the NCDC. How do you suggest this be handled moving forward?
Thank you very much. I have earlier talked about unity of command. This is a national emergency. In fact, it's a national emergency. The president is in charge. The president should compel the governor of Kogi State for health workers to have access to the people. You see, one of the greatest challenges we had was the polio issues in the north of Nigeria, which eventually I'm happy that have been sorted out. You cannot hide diseases. Even if there is none, let's have evidence that there is none. They should test, it doesn't matter. Some of the things we do is to bring out evidence. And it's not to say that you wait until they have before people can come in. I think that in this case, the commander-in-chief should use his powers and authority to compel the governor of Kogi State to allow access of health workers who are actually suffering to our people. Because when it exploded, when it explodes, like it did in Kano, it will be very difficult to contain. Let's prevent. You all say that prevention is better than cure. So why do we have to wait until we have explosion in Kogi State? Kogi State cannot be outside of Nigeria. There is a pattern, epidemiologically, there is a pattern of diseases. There is no way that Kogi State can be an isolated place. It is not correct. And I believe that if once the commander-in-chief decides and directs, and then, of course, with the coordination of the process, we should get into Kogi State and find out if there is none, if there are no cases, of COVID-19 in Kogi State. Why will he not be happy for us to give him an award for being very effective?
But when now talking about that unity in code having one approach, the indication we have from the PTF, we're expecting to see what the next direction will be. But what we have so far is that states will be taking more responsibility. So it appears as though states will get maybe some more freedom to choose what works for them. So do you still think that would give us that unity, that singular approach from top to bottom in court, if we're moving to a phase where states will have more responsibility?
When that of Kano started, the first thing the governor of Kano said he needed 15 billion. You see, this is an emergency. It's an emergency. It should not be left to the states, otherwise we are in for it. It should not be left to the states, otherwise we are in for it. The commitment of the states are not the same. We need the unity of command, and the commander-in-chief should ensure that all the states take directive from him, which it should not be left. If it's left to the states, local government, it's not about a sharing formula. It's not about sharing formula. This is an emergency that must be contained. And please, I beg the PTF, they should not leave it. They should coordinate all the activities of this pandemic. If you leave it to the states, we are in trouble. Why would they then deploy people to Kano? Because they thought everybody's commitment is the same. It is not. We want to beg, I want to use the name of Nigerian Medical Association to plead with the president and the PTF that they should please not leave it to the states. We know the powers of the states. Some states don't even have a single epidemiologist.
Right. On a final note, while we're not sure what that decision will be, we'll definitely wait to find out. But what would you propose? From what you have seen, the indications, the data, what do you think this next phase should look like? Should there be an extension of this gradual easing, by the way, which was extended for another 2 weeks? Should we extend it further? Should we move into another phase where it will be further eased, or go back to a lockdown? Basically, what do you expect to happen?
Well, that is speculative. What's the evidence on ground? For the past 6 weeks, what have we done? What is it that we have done that is working? And what is not working? How can we do it better? For me to I can't speculate. I mean, if you say lockdown is good, but it has its own implications. There must be palliatives. Everybody should be given support. Nigerians will be giving support. Is it possible? Is it doable? That's the questions that people will answer. It is true, it's very easy to say lockdown, but if you lock down, you must then follow with what is expected, and that is the palliatives. And Nigerians are crying all over the place that they are not getting the palliatives they say they are giving. And how long would they do that? The economy will ground to a halt. All we need to do is to reorganize, strategize, reevaluate, and see what works and what does not work. What is working, how do we do it better? What is not working, how would we do it what do we do to make it work? It's not just lockdown. The associated factors, the implications should be clearly defined. Left for me, lockdown, I mean, if we don't move, coronavirus does not move. But if you don't move and you have no food to eat, will you die of hunger? So we must balance our strategy. And that is the best way, in my opinion, to look at this thing. If you say people should stay in the house, many of the Nigerians go in the market in the morning and bring out and then sell their products and then bring in what they will eat in the night. It's a daily affair. So it is neither here or there. The economy is in tatters. The Nigerians are suffering, and I do not have the direct answer. But the truth is that we must balance our actions so that in the end, we do not leave ourselves worse than what we wanted to do. And that is my response.
All right, Professor Innocent Ujad, President of the NMA, thank you very much indeed for your time. And again, we wish you all the best.
Thank you very much. And this is my first official activity with channels. And I wish you the best. And we'll work together.
All right, thank you.
To our people.
All right, then.
A mandate. Thank you very much.
Okay, well, back in a moment. Stay with us.